welcome back. Good to see you again. What we like to start these little discussions with is just remind us, what brought you to see me in the first place? You had gone to Penta and then been referred here. So sometimes when I meet somebody and that's the case, I say, what had taken you there to begin with, kind of the chief complaint? And then what then brought you here?
Sure. Initially, I wanted to go because I wanted to get my septum opened up more. I felt like I couldn't breathe, both while sleeping and also just in my day-to-day. I always felt like congested, and it didn't matter what medicine I took. I just always felt like I couldn't breathe.
Yeah. Was it more one side than the other?
It was.
Yeah. And that's common for the septum, I think. It's just that lots of people don't breathe well through their nose. I'm regularly like quizzing them, like, is there a good side and a bad side? I think because when people have this alternating trouble breathing through their nose, like they say sometimes the right, sometimes the left. So that indicates to me there's probably something structural or anatomic. That's like,
and it didn't matter how much I exercised. I felt in shape, but I couldn't breathe, which was weird. At first you try and justify why you can't breathe and going through your mind of all the reasons why you might not be able to. And really it's pretty simple.
How are you breathing now?
Very good.
Yeah. Okay.
I can't think of a time in my whole life where I've been able to breathe out of both sides of my nose at all times.
You had gone to Penta, and like I've told so many patients, those are great doctors. I love them. They're my old partners, and lots of them take care of breathing through the nose. But what then diverted you to come meet us?
Yeah. So I always felt like I did not like the side profile of my nose. I would see pictures or certainly even like a selfie that I was in full control of the camera angle, and I just didn't like it.
Yeah.
It wasn't something that I feel like most people even would have noticed, but I noticed it. Yeah. And I didn't feel like it made sense to do two separate surgeries to tackle the breathing side, and then maybe we'll later on tackle the cosmetic side. Yeah. So you came highly recommended by Penta, and I called your office after leaving there.
Okay. Tell us a little bit about when we first met. Did you feel like we explained things to you well? Did you feel just like we did a good job of maybe showing you some other before and after pictures? Was there anything that you're real curious about still kind of at the end of the consult day?
No, I think you covered all my questions. Okay. My biggest reservation was that recovery period. And that's really what had kept me from even checking into this prior to being, in my mid-30s. Right. Was I had always had this idea that it was going to be this extended recovery time. You were going to have this awful bruising, awful swelling. Right. The whole world was going to know that you'd had this surgery. Okay. And you were going to have to pause life for, 3-4 months. Like, I don't know why I thought that, but I did.
I think it's true of patients when it's something they've never been through before. And it might be a rhinoplasty, a nasal surgery, or it might be another kind of surgery where they regularly think it's either a lot easier than it is or a lot harder than it is. Mm-hmm. I even think that's true sometimes of cost. Patients either they just speculate like it's either a lot less expensive or a lot more expensive. And then so just the best way always is just come talk to somebody or talk to somebody else that's gone through it. Tell us a little bit about what was surgery day like and what was first week like.
Yeah, so going into surgery, I think I was just so excited to have the procedure done. I'm not typically a worrywart, but coming out of surgery was what I was worried about. I felt like when I woke up, I was going to feel like a truck hit me, right?
Yeah, just feel bad.
Yeah, and just feel really horrible, but it's just part of the process. And I can remember waking up out of surgery and thinking like, wow, I should feel a lot worse. And I don't. So that was a good relief that I didn't have that experience. So going home, I was just basically sleeping the whole way home. I wouldn't say that I felt bad. I wouldn't even say that I felt any kind of nausea.
Good.
Overall, considering I felt great.
Yeah. Did you take a few of the pain pills that I prescribed, or did you just take Tylenol and ibuprofen? And then about how long? 1 day, 2 days? How long did you take a little pain medicine?
Yeah, I believe it was like 5 days.
Yeah. Okay. Yeah. So you did take some pain medicine.
Yeah, but it wasn't like, oh my goodness, we're coming up on the time to take my next dose, and I'm like in a lot of pain. I can't live without it. It was more so just for the comfort, and I wanted to be able to rest and get that sleep in so that I could heal quicker.
When I talk to people about, tell me a little about what kind of work do you do? If it's computer work or desk work, not manual labor. If it's manual labor, I kind of want you to be more careful for a little bit longer. But I'm trying to tell people that the first 48 hours, I really want you doing nothing, planning to do nothing. And then give yourself another couple of days just to be kind of clear-headed. And then even though you have like a splint or cast on your nose, maybe have some bruising and swelling, by day 4 or 5, you can get back to the computer like responding to some emails or looking at some emails or spreadsheets or whatnot. Do you feel like that's pretty accurate? Like you could?
Absolutely.
Yeah. Okay.
Yeah, and I work fully remote.
Right. Yeah.
I'm really heavy in emails, so I didn't take any calls because I just wasn't sure if we would have like an up day and then a down day, you know. So I just blocked off the calendar. I had the luxury of taking 2 weeks off.
Did you? Yeah.
But honestly, I feel like I probably could have gone back if I didn't have that flexibility at work. I could have gone back probably day 7 or day 10.
Yeah.
So I was thankful to have the time off, but I could have absolutely written emails and had the ability to sit.
That's kind of savvy to be on the safe side, but that's about exactly what I try to tell people is you don't need to have to take a full 2 weeks. You probably could start doing your job pretty well at 1 week once the cast's off, and if you feel comfortable and if you can work from home especially. So tell us a little bit again about the bruising and swelling, and tell us about that evolution during that first week.
Yeah, so day 2 to 3 was, I mean, my eyes were really swollen. You probably wouldn't have recognized me as my usual looking self. But by day, I would say 5 to 7, I didn't have the swelling around my eyes like I did. It went just as quickly as the swelling came on, it went away.
Okay, good.
I still noticed, probably a little bit of that lingering.
When do you feel like you first started getting a little excited or happy or pleased?
So it was really exciting to get the cast off.
Okay.
Now looking back, I realized that it looks completely different because I did still have swelling. But even in that moment, I could kind of see past the swelling and feel like that bump was gone. And not to mention the breathing I could breathe the moment I came out of surgery. I would say true excitement of where you just one day you look in the mirror and you're like, dang, I like this. I would say around 6 to 8 weeks.
Perfect.
Yeah, 6 to 8 weeks.
Yeah, that's great. Everybody's going to be different. How far out are you now? I'm sometimes bad at remembering.
3 months.
Yeah, your surgery was about 3 months ago. Just a summary question, kind of a last interview question. Just tell us about just real general the experience overall, just with us, with the practice, with me in general. Is there? And you can summary statement or however you want to.
It's been a great experience, and if I had the choice to do it again or to do anything differently, honestly, I am just so thankful that I went here. Your team's been amazing. You were amazing. And even over at the surgical center, they all were great in caring for me post-op. They called to follow up. Your office was very proactive in following up. Very easy to get appointments and feel like I'm, welcomed here in the office. Definitely recovery was, I would say, smoother than what I had envisioned.
Good.
So I'm excited.
That surgery center is Piedmont Outpatient Surgery Center. There's no sense in not giving them a good shout out when they
there
deserve
we
it like
go.
that. So.